Good afternoon, everyone. Thank you so much for joining us for our special series webinar. We'll give it just a moment and then we will go ahead and get started. Thanks for being here. Once again, I just want to thank everyone for being here with us today. We're giving this about a minute or so to let others join, and then we will get started in a really great conversation today around the early childhood workforce. As you join, I see some already starting, but if you'd like to introduce yourself in the chat, that would be wonderful. All right, well, good afternoon, everyone. We are so glad that you are here with us today. My name is Lauren Zabinski. I am the Deputy Director of Early Learning Policy here at the Hunt Institute. And for the benefit of anyone who may be joining us, for the first time today, the Hunt Institute is the creation of our founder and namesake, Governor Jim Hunt, four-term governor of North Carolina. We serve as an education policy support to governors, state legislators, and other high-level state elected officials. We cover the full spectrum of education from early childhood all the way through to the workforce. It's terrific to have you all here with us today and to see you all introducing yourself here in the chat. It's always really exciting and interesting to see where you all are joining from. Lots of states that we're seeing pop up in the chat already. Before we get started today, just a few quick housekeeping notes. Later in the hour, we will have the opportunity to open the webinar and the discussion to questions from you all as our audience members. So if you would like, you'll also note that there is a Q&A button at the bottom of your screen. If you would like to post any questions you have that you would like highlighted to the panelists, please post those there in the Q&A. We ask that you post any questions there in the Q&A versus the chat, because as you can already see, our chat gets overwhelmed with introductions and recognizing where people are from. So throughout this time, as you hear our wonderful panelists join in conversation, please post any questions you have in the Q&A, and we will do our best to get through all of them later in the hour. Also know that today's session is closed captioned. You can access that also at the bottom of your screen if you would like. Finally, you will be able to see this recording of today's webinar in a few days as it posts to our YouTube channel on our Hunt Institute website. With all of that out of the way, I'm excited to help us transition to getting started on such a fabulous conversation in lieu of supporting the early childhood workforce and looking at investing in the early childhood workforce. This is one of our special series, is why we are on a Wednesday versus a Tuesday. The title for today is Addressing the Compensation Crisis, Innovative Ideas to Sustainably Support Our Providers. As part of this special series, we will focus on the early childhood workforce and are proud to present this series in partnership with Bank Street. With that said, I'd like to introduce Emily Sherrick, Associate Vice President of Bank Street Education Center. Emily, the floor is yours.
Thank you, Lauren. And thank you to everyone at the Hunt Institute for co-hosting this series with us here at Bank Street to elevate critical considerations for strengthening investments in the workforce. For over 100 years, Bank Street has focused on how children learn and what teachers need to help children succeed. As we all know, a significant period of brain development takes place from birth to age 3. And during that time, developmentally meaningful interactions and experiences build the foundation for all future learning. At the same time, we know that most infant toddler educators are paid poverty wages, despite the crucial work that they do each day, which is not only unjust, but it also undermines our collective ability to recruit, retain, and train educators. Many have called for compensation reform, and while momentum for these shifts is building in exciting ways, real questions remain in the field about how to structure the policies and implementation strategies needed to do it well. Many states have used ARPA and other relief funding to pay for one-time bonuses. States and local governments can build from that success to do more and to sustain wage increases. Today, we look forward to hearing from our panel of experts about concrete ways to do this across a range of political contexts. Our hope is to inspire other states by offering examples of how to finance and structure compensation reform with the ultimate goal of achieving pay parity for early educators with our K-12 system. As we dig in today, I also wanted to share the great work of Harriet Dichter and Ashley Libetti, who compiled a compensation backgrounder, which provides even more information than we're going to have a chance to cover today about efforts across the country. So we're going to go ahead and drop that into the chat now for those who want more ideas. To understand more about the innovations in early childhood compensation, we are joined today by 4 experts in the field. We have a diverse group joining us today, including people from cities and states that have made big investments for early childhood compensation, and those from states that are finding creative ways to do what they can given available funding and, again, different political contexts. They are Graham Dobson, Senior Policy Analyst from the Department of Early Childhood in San Francisco, Bibi Otero, Senior Advisor for the Under 3 Coalition in DC, Tara Williams, Executive Director for the Maine Association for the Education of Young Children, and Erin Arango Escalante, Administrator at the Division of Early Care and Education at the Wisconsin Department of Children and Families. I also want to take a moment to thank the Center for the Study of Childcare Employment. Their staff introduced us to Erin, and they have created a database of compensation strategies, which is a rich resource for learning about what states and localities across the country are doing. So we're going to drop that resource in the chat before we get started too. So our first set of questions is going to focus again on this technical aspect of increasing compensation beyond one-time bonuses and the use of relief funding. So Graham, let's go ahead and start with you. Thank you for taking the time to join us today. You currently serve as Senior Policy Analyst for the San Francisco Department of Early Childhood, which received significant funding from gross tax receipts. Can you tell us about the structure of the new tiered model that you've created, including the amounts that educators can expect to receive and how this additional compensation will reach the pockets of providers, a critical challenge many face?
Sure. Well, hi, everybody. I'm Graham from San Francisco. And we are the brand new Department of Early Childhood, which actually just came into being July 1st this year. We are a combination of our first 5 San Francisco and San Francisco Office of Early Care and Education. So if we go to the next slide, today I'm going to be looking at our brand new workforce development and compensation initiative that, again, has just rolled out at the beginning of this fiscal year, just in July. We're still in the very early stages of this. It's very exciting. So I just wanted to give you a brief overview of what we're doing here in San Francisco. The next slide will show you that the child is always at the center of any work that we do here at the Department of Early Childhood. And so, we really believe that by supporting the early educators that are working with our children, we will impact the quality of the experiences that our children have in those programs. And so if you look at the next slide, you can see that we're looking at different phases of how we're implementing this initiative. Phase 1 is looking at direct compensation to the teachers, the educators that are in the classrooms and in our family childcare homes. We have a funded network here in San Francisco. We have within our Early Learning San Francisco programs that are funded and supported by our department. And so all of the things I'm talking about right now are targeted specifically for those programs that are already part of our network. Although our network is open to anybody to apply, any centers or any family childcare homes who want to participate, they have to meet some quality assurances and some assessments in order to become part of our network, but this is open to everybody in San Francisco. So the first phase is looking at compensation directly. The wages that the educators are receiving. Phase 2 will look at further compensation. We know that there's a compression issue. When you increase wages of teachers in the classrooms, there's going to be a domino effect for those other employees in the programs, especially the directors, other site supervisors who may not be in the classroom, other support staff who are working directly with children but may not be classroom teachers. We know that there's a domino effect there, so we want to address the compression issue in our second phase. And also we want to provide some flexibility and allow programs to look at benefits that are being provided and use some of our funding to increase benefits or actually provide benefits that aren't already part of their program, such as retirement or health or transport, funding, that kind of thing. The next phase is around workplace conditions. So again, more funding going to our programs to provide support in getting, helping improve workplace conditions for the educators, such as time off the floor to do observations, to plan with their other teachers, to really give them time to spend away from the classroom and get compensated for that, so it's not additional to what they have to do. And our phase 4 here is our workforce educational pathways. We can't do any of this without supporting teachers to actually be able to access higher education, city college, 4-year courses, above that, master's courses, whatever they want to do. We want to provide the funding that's necessary to support teachers in our programs to be able to access whatever level of education they'd like to follow. That's kind of a parallel process rather than just a separate phase 4. So our next slide shows us that, we've been doing a grant program here in San Francisco for several years now. It's called CARES. And it's actually, the last one was CARES 2.0. And so we've been providing grants to the teachers in our programs with about $8,000 a year with two payments throughout the year. And that's been one size fits all for all of the teachers that are eligible, that are on the floor for 20 hours or more, have been able to receive that grant. So we've been doing that. And then we also want to make sure that we do a stipend program too. So we've been doing these two programs up till now, where we've, this has been our delivery system up till this point. And we're trying to shift things from these one-time bonuses, one-time payments, to try to do something a bit more systemic here in San Francisco to really address compensation within ongoing wages, rather than just once, one point of trying to provide funding, So the next slide will show you that we are looking at a tiered compensation package. So, the programs that we have are a wide range of private, for-profit, non-profit, state-funded Head Start programs. And so they're part of our already existing system. And, we wanted to tier the resources that we're providing to these programs, based on the percentage of subsidized families that those programs are serving, whether those are subsidies from the state through like CCDBG, or whether Head Start subsidies, or whether local subsidies that we provide here in San Francisco. So we have these 3 tiers, these orange, blue, and green tiers. And for the orange tier, those are those programs that are serving less than 20% of subsidized families. The blue tier are those programs that are serving less than 50% of subsidized families. And the green tier are those programs who are serving, between 50% and 100% of subsidized families. And so we're continuing with our sort of stipend program, with our orange and blue tier programs. We're calling it this new revamped version of CARES 3.0. There will be some tweaks to that, which I'll go into a little bit later. But for our green tier, the family childcare educators will be in the green tier, will still be receiving a stipend. But for our centers that are in those green tiers, they will be receiving a grant that will go directly to them to then increase the compensation for the teachers in their programs. So this is our 3-tier model. The next slide shows that our baselines are basically living wage, and with a pathway towards parity with our local San Francisco Unified School District, with those educators who have equivalency of the education at those different levels, both the pre-K level at SFUSD, for those teachers in the pre-K program there, and for those teachers that are in the TK, transitional kindergarten to 12 at SFUSD. So, we really want to have these two benchmarks, this baseline of living wage and this pathway to parity for compensation for those teachers who have the equivalent educational qualifications with SFUSD teachers who are serving the same age children. So our next slide shows that it's going to be a little different to what we did before, whereas we had this one size fits all for our stipends that we were giving to the teachers through our stipend program. It was the same stipend for everybody, same amount, regardless of whether you were full-time, part-time, whatever your educational qualifications were. Well, now we have some eligibility criteria that impact the amount that you will be receiving, the educators would be receiving, whether in a stipend or through their the grant that goes to their program. So, the percentage of the priority population served within the program, the agency, that will impact the amount that will be given to the educators based on that model that I showed before, the tiered model. The role of the teacher, a lead teacher versus an assistant teacher or an aide in the classroom, the educational level of the educator, and whether that person is full-time or part-time. And so the next slide shows that this is a lot of information. I think you'll get these slides afterwards. So I only have a certain amount of time, so sorry if I'm rushing through, but it will show you that these are the orange tiers, the blue tiers, and the green tiers. Even though this says the family childcare pay scale, this actually also applies to the teachers in the centers who are in the orange tier and the blue tier also. It's the same amounts for both family childcare educators and center teachers. And so you can see the range is really huge from 4,000 for a part-time teacher in the orange tier of $4,000 a year to a full-time teacher in the green tier of a lead teacher of up to $39,000 a year. So the scale is, the range is huge, but you can see that it depends on what, the priority of the tier, what, the amount of subsidized children and families that they serve, and also the educational attainment. You can see it's 12 units or below, up to a master's degree with ECE units, and also whether that teacher is part-time or full-time. So it's a whole sort of menu of amounts that might go to teachers, whether you're a lead teacher or an assistant teacher, and depending what program you're working in. So the family childcare educators will all be receiving stipends based on this, and the teachers in the centers in the orange tier and the blue tier will also be receiving stipends based on all of these factors at these same amounts. Now, for the next slide shows that for the teachers in the centers who are in the green tier, our baseline, that living wage that we talked about, is a minimum of $28 an hour for those assistant teachers. Any teacher, baseline, if you're an assistant teacher, that's the baseline amount for sort of entry level educators in the classroom. And we base that $28 an hour on the MIT sort of living wage calculator to get that baseline amount. And I have to iterate that that's in San Francisco, that baseline is one adult, no children. So we're really starting at the sort of a real baseline that doesn't, but still with the amount of money that we have, $28 was what we came up with to start with at that minimum amount. And then we're looking at, for those lead teachers or teachers with a BA, that would be a minimum of $36.74, almost $37 an hour. And for those teachers, lead teachers with an MA, it would be a minimum of almost $47 an hour. So, there'll be some money that the programs, the centers that are part of this grant program will receive for that flexibility between the baseline and between the baseline and the BA and MA teachers. We know that there's a whole range in there. Programs might want to support and compensate years of experience, other skills, special skills that teachers bring to the program, other languages that teachers are using in working with the children. So we wanted to also provide funding that allows flexibility within these required amounts based on baseline and BA and MA. We are in a very lucky position here in San Francisco. We had a ballot measure several years ago that brought funding directly to our program to support children and families and teachers. And we have about $60 million a year, which is a lot of money to support this workforce initiative moving forward. I know we have limited time, so I'm going to stop there. There'll probably be more questions later on. Thank you for your time.
Thank you, Graham. Erin is the administrator for the Division of Early Care and Education for the Wisconsin Department of Children and Families. You have a goal of diversifying revenue for early care and education to shift the cost burden away from families. And you've engaged businesses in this effort through a program called Partner Up. Can you talk about the structure of Partner Up's cost sharing model for co-pays and other ways that you're diversifying childcare funding through childcare counts?
Absolutely. Thank you, Emily. If I rewind back to 2020, it was an important year. It was a difficult year for all of us. It was also a year in which Wisconsin received our preschool development grant, our planning grant. We were a year behind most other states. And because we received our planning grant in 2020, we were able to focus on our needs assessment and our strategic plan while we were going through COVID, which would have looked different had we have done it a year prior. And what was important about that as we developed our strategic plan is that we were able to look at how do we move the needle in access, affordability, quality, and workforce to advance and promote equity and inclusion in our state. And in looking at that, one of the aha moments that we had was we needed to diversify our revenue. And in fact, that became very apparent. And at the same time, that is when our CARES Act dollars came out, then our Coronavirus Response and Relief Supplemental Appropriations Act, followed by our ARPA dollars, stabilization and supplemental. So there was a little bit of a blessing in disguise in terms of timing, because we were able to plan out and set the map, the roadmap for these dollars that were coming in to diversify funding. So a couple of things I want to talk about. Partner Up came out of a conversation within each state agency was at the table, as well as our Department of Public Instruction, our state superintendent. And so there were many different players at the table, from tourism and natural resources to health services to revenue, you name it. Everyone was at the table. And we noticed, this was including our governor, first lady, and what came out of that conversation was a real focus on children, on families, on communities, on workforce, in the economy. And so in connecting all the dots, we thought about this program, Partner Up, which really said we want to invest. We want to invest in this entire system. And in fact, we want our employers, our businesses to also invest. And we want to show the return on investment, the return on investment in their employees, looking at absenteeism rates, productivity rates, just overall sense of like happiness at work, and to help them then recruit and retain staff. And so what we did was we created Partner Up that basically said, we are going to invest dollars looking at multiple funding sources. So everything from our preschool development grant, our CURSA dollars, our ARPA dollars, you name it. And we said, we are going to have businesses apply that are interested in really paying for the true cost of care, which is important here, the true cost of care for childcare for their employees. And in the first year, we are going to pay 75% of that slot, and the business contributes 25%. And over the course of time, you see that flip. You see then businesses take on more of the financial responsibility. The state then decreased their amount, and then parents coming in paying a subset as well. So we have just kicked this off in Wisconsin. We had interest from all of the sectors that I named. Obviously, staffing is an issue. Recruitment and retention is an issue across all sectors in Wisconsin. And so we have, so many different industries taking advantage of this program and really beginning to look at their employees who are interested, being able to purchase lots, and actually businesses saying, I can contribute more than that 25%. I could go up to 50%, 75%, because this is important to my employees. And we're going to be looking at the data soon to look at what is the outcome of their return on investment, and how is this going to be sustainable over not just the next 2, 3, 5 years, but 10, 20, 30 years. And so really showing what this can do for their employees. So that's the first piece that I wanted to share. It's exciting. We have a lot of businesses that are exciting, chambers of commerce that are excited. It's really catching on, both with our legislature, but also community members as well. Now, it's important to know that Partner Up is one of many strategies that we are using to address compensation. The other one is childcare counts, which again, because of our strategic plan, allowed us to think about early on, and has changed over time throughout the pandemic. We have invested a little over $650 million to go directly to childcare providers, whether they're a family childcare provider, a group provider, it doesn't matter. They just have to be a regulated provider. And the idea is it goes directly to providers to focus on increasing access to high quality care and focusing on efforts around recruitment and retention. We have had a number of payments go out directly to providers, but most recently with our ARPA dollars, we have 27 months of ongoing payments that is based on enrollment, and it is based on staff. There are dollars that go directly to the program. Of these dollars, there's a certain percentage that goes to focus on increasing access to high quality care, and the other percentage that goes directly into the pockets of our people who are caring for our children, the teachers, the assistant teachers, the bus drivers, the cooks, you name it. Anybody who is really providing that support, that high quality care to our children. So it will continue. We have, roughly another 19 months left of these ongoing payments that childcare providers know are going to happen. This then sets the advocacy lens for thinking about an ongoing state investment for childcare providers. The money's needed. We need to diversify the revenue that's coming in. Our CCDBG dollars are not enough. That plus parent tuition, it's not enough in order to really fairly compensate those who I argue are doing the most important job in our state. Thank you.
Thank you, Erin. Tara, we'll turn to you next. As the Executive Director for the Maine Association for the Education of Young Children, you led efforts to create sustainable compensation increases for the early educator workforce. Tell us about your success extending monthly bonus payments from ARPA with state tax dollars and your plan for future sustainability in Maine.
Yes, thank you for having me. It's great to be here today and to also be learning from other states and cities about this work. So at the Maine Association for the Education of Young Children, we help lead a coalition called Right from the Start. And we've been working with dozens of state partners from state offices to nonprofits, advocates, childcare programs, Head Starts, family childcare for many years now. We do this all in trying to really focus on how to help improve family supports and services in Maine, early childhood financing, systems, data, as well as conditions for the early childhood workforce. And over the last few years, our coalition made helping and supporting the early childhood workforce, predominantly those who work in childcare, a top priority, really recognizing that this is one of the most important things to work on right now in order to have a really strong, stable childcare system in our state. Now, just quickly, some background on it, because as with many policy changes, this is years in the making. This happened this year, but it's been being worked on for many years. We actually, the original bill that was introduced that led to this was from 2019. And in that bill, it had $2 million in it for wage supplements. And then it had a bunch of other supports included that were really to focus on career pathways. So having some funding in our state for scholarships, for apprenticeships, to support the career and technical education programs that high schoolers can be a part of in really starting their career as high schoolers. And the first bit of good news is that we were able to work with folks in departments and the governor, the Mills administration in Maine, to really begin those investments pre-pandemic and during the pandemic, even though that bill was actually carried over to 2020 and then died because of the pandemic when the legislature stopped meeting due to COVID-19. But what we were able to do is continue working with folks on the ground about what a new version of that bill might look like. And because, and I know we're experiencing this and we have been across the country because of the global pandemic and this really huge awareness that grew out of that about the needs in childcare, folks were really from state legislators to administrators in our state government to those of us on the ground looking for a better solution. We'd been part of state groups, I'm sure many have done this, work groups for years, state plans that talked about compensation as a major issue, but kind of a asterisk, medium to long-term goal. We don't know what we're going to do with this because it's so big and so complex. And now we were really looking for what to do. So this now ends up coalescing around Maine's Department of Health and Human Services decided as part of the Child Care Stabilization Grants to make sure that each monthly grant would include $200 per month per person working in childcare in Maine. And that started last fall, in fall of 2021. And it's a one-year initiative, so it wraps up in a few months. And what this gave us was some almost a pilot program, some data, stories, and ability to measure impact over this year of what happened when we had not only this sustained investment in childcare, but that part of it included ongoing wage supplements. And what we found was, as I think many are finding with their ARPA dollars, that there's really significant impact, that people were able in Maine to recruit and retain staff. It helped to just shore up the stability of our system. And so what we ended up working on with this bill with both folks in state offices and the lead sponsor of the bill is a way to transform it into something that went from, as I mentioned, $2 million years ago. It was at $5 million, now up to $12 million for wage supplements. And I think what was really exciting for us this spring is looking at all the groundwork from grassroots advocacy to work in the legislature came together in the spring when the Speaker of the Maine House called this bill to a vote in the state House and then the state Senate. And it received unanimous support from every legislator in our state, a full nonpartisan support across the state. Our governor then put the same language from the bill and $12 million into her supplemental budget. And so that really is the practical logistics around how this is continuing in Maine. It's $12 million to basically take what will end the wage supplements that are ending at the end of September this year and make sure that that funding comes around until June 2023. The other piece of this initiative is that it says in our state language in this initiative that by next June, these wage supplements need to be tiered. We don't have a graphic or a chart to show you today because we haven't yet in our state made decisions around exactly what that tiering will look like. But our plans are to tier it based on both experience and credentials and degrees, and to really be thinking about some of what you've been hearing today in the webinar about part-time versus full-time and other aspects of folks' jobs. And so this translates ongoing into $15 million in state funding in Maine, because this $12 million is a 9-month initiative. So $15 million a year to really make sure that this is sustainable. Now, we're viewing this as a bridge into hopefully a longer term solution that will really be able to combine state money with robust federal investment that would allow us to ensure a thriving wage for early educators with wage parity with their K-12 peers. So this does not achieve that yet, but it is we feel a great step in the right direction.
Thank you, Tara. And last, we have Bibi, Senior Advisor for the Under 3 DC Coalition. You helped to lead the efforts around parity compensation. Can you tell us about the process of determining the amounts of the one-time payments, drafting the parity compensation scale, and how money will reach providers?
Great, thank you so much for having me. This is very exciting because we've I think gotten to a place in DC that we've been working on for years, as many other those of you listening as well as those on the panel have been. So I come out of the provider world. I was a provider for 25 years and then went into policy work. So this is very dear to my heart. I want to put the response in a context of what's happened in the District of Columbia. In 2008, we passed the Pre-K for All DC legislation, which set the wages for, it set the universal pre-K for the District of Columbia in community-based and public education and charter schools. And that all of those who participated, the teachers in those pre-K classrooms for 3- and 4-year-olds would receive the same compensation as the public school teachers. Not benefits, just compensation, asterisk that. So fast forward to 2018, again, years of lots of work and advocacy around this issue, and we passed the Birth to 3 legislation. The Birth to 3 legislation is more of a systems approach to looking at early care and education from a health, nutrition, as well as and child well-being and early care and education. The legislation really sets mandates that teachers and educators in Birth to 3 programs were to receive compensation commensurate with that of public education, assuming equivalent credentialing and experience. And so that sets the tone for the fact that where we were headed to is parity. And it's already codified in law. We worked through the coalition first to get the legislation passed, and then formed a coalition across not just early care and education, but many of the advocates that are advocating around families, children, economic justice, et cetera, and worked with them to ensure that we could come up with a mechanism for public funding that didn't pit one of us against the other, and really thinking about tax justice as the key to our work. We were able to get the Council of the District of Columbia. Remember, the DC is a state. For many of these, or all of these functions, we really function as a state rather than a city. We passed a wealth tax on the highest income earners in the District of Columbia, which in the first year, which would be this year, it would generate somewhere in the $55 million, and by year 3, it will be around $70 million for the child care piece, and the rest of the dollars will go to housing, as well as increasing the earned income tax for families. So it was a coalition across the kinds of key pieces, economic justice, as well as early care and education compensation. And this is strictly for compensation, the dollars are. The initial legislation stated that we needed to put these dollars through our subsidy program. Once we got to actually having secured the funding, we were all in agreement that it was not sufficient to do this through the subsidy program, or efficient or effective, as well as through the cost of care, and really to do it as a separate fund. So we've created a separate fund that it was put in a non-lapsing account in order to make sure that even if it took us a little longer to decide how to distribute, that we wouldn't lose the dollars. So that was a really important piece. The council created the Early Educator Equitable Compensation Task Force, and that task force recommendations were accepted by the council in March. And basically, it's a two-step process. The fiscal years 22, 23, and maybe 24, it will be supplemental payments directly to educators, $10,000 for assistant teachers in a childcare facility or in a family childcare, in a center-based or family childcare, and $14,000 for teachers, and say in one or more installments. But that is really the first phase in order to prepare to allow the system to build the infrastructure to have these dollars go into actually meet a new salary pay scale in parity with public education, and go directly to the providers for, and there are a number of steps infrastructure-wise that the state really needs to implement before it can actually do this as part of salary of individual salaries. So we're doing supplements for 2 years, and then we're doing salaries. There are a number of considerations that were also raised by the task force. Set some salary minimums. It also set some considerations to make sure that during this 2-year period, we look at ways to limiting administrative burden. We look at cash flow issues in terms of reimbursements done rather than doing this as a reimbursement basis, paying up front, because we know that's a huge issue for providers. Making sure that wage compression, that's, I think Graham raised those issues, as well as ensuring that we can support providers and educators in the best way possible as they move into higher salaries and the cliff effect for social supports. And so that's an area that we're paying a lot of attention to, and making sure that whatever policies at a state level we can put in place to make sure that folks aren't having to make a decision between getting a supplement and losing some of their social supports, whether it is housing or SNAP or even childcare for their own families. The other set of considerations is really looking at equity concerns, undocumented educators, language access provisions, individuals with limited literacy and tech. We have our regulatory pieces have changed so that we have new requirements for credentialing for providers, including waivers for those who have longer years of experience, but will most likely not be able to go in and get the formal education and certification, but yet their experience really counts to all of that. And so this first tranche of supplements, to your question of 10,000 and 14,000, is really based on the pots that's available this year and the number of teachers and assistant teachers in our system. As we move further and get better data, we'll have a better understanding of how many teachers we have and what additional resources may be needed. But what is really, I think, really important in terms of our piece is that we were looking at making sure that we had a stable, secure funding mechanism that ensured that this was not going to be one time, and that we followed a piece of legislation that was already in place that is parity with public education. At the end of the day, I think there is a very strong belief for all of us that early care and education is a public good, just like public education is, and we should fund it in those terms. We don't think these dollars are going to give us enough for the benefits that are needed. And so that's another challenge that we have to look at moving forward.
Thank you so much. And thank you to all the panelists. I'm going to turn it back over to Lauren for some additional questions, and also want to remind folks to submit questions to the Q&A, because we will be moving to field some of your questions shortly.
Great, thank you, Emily, and thank you to our wonderful panelists for providing such a in-depth and thorough kind of introduction and overview of the work that you all are doing. It's fascinating to hear, encouraging as well, as we're all from different locations, and to hear that there is work centered on this important topic in each of these spots. With that in mind, I want to pose a question to you all as a whole and allow you each an opportunity to respond. In this conversation, we were talking about workforce and compensation supporting the workforce. So thinking through that, curious about how you in your work have actually listened to, learned from, and partnered with the providers that we are talking about doing this work on behalf of. And how have this helped to devise these strategies and these approaches to structuring compensation increases? Graham, I'd love to start with you, and then we'll open it to everyone else to pitch in.
Yeah, because we've been doing the stipend program here in San Francisco for several years now. We've had many focus groups and roundtables directly with the teachers and the family childcare educators that are receiving that have been receiving those stipends. So they directly impacted how we rolled that out and what that program looked like. As we're continuing with this new compensation initiative, the stipends are a big part of that. So the family childcare educators and some teachers will still be receiving those stipends, although I did explain how they look a little different this time around. But the thing that we've been actually working a lot with the community around has been the grant program, because that's very new. So this grant that will go directly to those centers in the highest tier. We got a lot of feedback and a lot of bumps in the road around what that would look like, because it's one thing to devise this system, and then it's another thing to operationalize it. So we've had many meetings with the directors and the administrators of those programs who are receiving the grants. We although the program starts in July, we're not going to have it actually started until October to give a bit of a ramp up time for programs to really figure out how this works for them. But though it will be retroactive until the beginning of July, so the funding will be available for those teachers from July. But we wanted to give those programs some time to really think about how to implement this. And with things that we've talked about, this educational equivalency, sometimes it didn't work for our state funded programs that have these different permit requirements for the teachers in their program. The compression issue, we're really looking at that phase 2, like bringing that compression issue, that phase 2 closer to this first implementation, so that it can almost be the same rollout, so that we can impact both classroom teachers and non-classroom staff at the same time, because I knew that was a big issue that we heard from the program. So yeah, we've been really trying to tweak and come up with solutions that have been raised by our green tier centers specifically, as we've moved forward and rolling this out. So yeah, it has to work. We want it to work for everybody, so we have to listen to the programs who are actually going to be benefiting from this in order to make sure that it does work for them and for their staff.
And how about others? How have you incorporated the voices?
Couple of things. We've been very fortunate to have really strong philanthropic dollars available for our coalition building, as well as for ensuring that that we have the kinds of studies and the kinds of work, background information that's needed to support the work that we're doing. Some of those dollars have also gone to strengthening the associations and making sure that they're staffed, and making sure that, because that's a place through which there are the voices of providers are really critical. And so the various childcare associations. The other is through our coalition, having full coalition meetings, bringing every decision to the table, so that providers, both at the teacher level as well as at the educator level, as well as the operator level, have a voice. We know that those larger providers with more sort of political muscle sometimes have louder voices. So making sure that we create space for those that may not have those access to the sort of the political structures. And the other is language specific gatherings and within the coalition for folks who feel more comfortable in their own language, and to make sure that we are paying attention to the issues that are key to our immigrant communities, et cetera. And a couple of those things that have come up is how to make sure that we take into account and look at how foreign credentialing is looked at, and how it's valued, language, document status, immigration status, and the various, I mean, there's so many, right? TPS and DACA and this and that, and making sure that we are providing the State Office of Education with as much information around that as possible so that their decisions are broad and cover everyone.
All right, Erin, anything?
Both unmuted. I just wanted to quickly thank BB for bringing up the strength of associations, because we really benefited in Maine also from philanthropic dollars and helping to build up the capacity of our association as well as others. And we worked so hard in the past 5 years to not only engage and support and train the providers and educators in our state around advocacy and policy, but to try to build bridges between our associations. So we work a lot together with the Family Child Care Association of Maine, YMCAs of Maine, Head Start directors, and bring our voices collectively to our state administrators and legislators. And that was, similarly to what's been shared, a big part of how this policy came to be. Many integral pieces of it, from who the money goes to and how it's implemented, came from the field in focus groups with them. So I'll turn it over to you, Erin.
We had a similar situation where we had so many focus groups, so many opportunities for feedback. And what we learned is we need feedback early, we need it often. And for us, the other piece that we learned is that we really needed to talk with parents and caregivers too, and how they benefited from this. In getting that perspective, that lived experience, that perspective really changed some of our thinking in some of the policy decisions that we made. So it was a unique perspective that we are really learning to flex this muscle. And I think it's just a really important piece to add into the large table.
This is all great. It's so interesting to hear how you all have incorporated it in your own meaningful ways. I'm mindful that our time is starting to get really tight here, but have a question that's been posed that I think will be so beneficial for everyone listening. And how have you built the political will and buy-in for this work? And Tara, I'd love to start with you, and then maybe to Erin, BB, and then Graham to close us on that.
Sure. As I mentioned when I was sharing earlier, the building political will was such an important part of getting this change in our state. And what an exciting day it was to get unanimous support in the full legislature. That's not something we see very often in Maine on any issue. And this came from a lot from the programs, educators, providers in our state who had been for many years working with us to invite their elected officials to visit their programs, to learn about what they do, their work, their struggles. And we continued those into the pandemic with virtual visits, even doing kind of funny things like, if anyone's heard of Flat Stanley, where you have a little flat character, we had like flat state legislators that we could put in different parts of the child care center and pretend they were visiting, and then they had Zoom calls and all kinds of things to engage them. So that has been a big part. Another one is that part of our philanthropic funding has helped support the launch in Maine about 5 years ago of a children's caucus in the state legislature. And this caucus used to meet in person, now meets virtually. They receive a lot of knowledge, training, and support every session through presentations from experts around the country that has built up their knowledge of brain science, return on investment, all different aspects that are important to understanding childcare and early childhood education. So that's been a big part for us, as well as working, because we're on the advocacy side of this, working as advocates to really build strong and trusting relationships with state offices, administrators, and legislators to do the work together.
So again, in addition to what Tara said in terms of relationships and engagement being so critical here, in inviting our legislators to see the work in action, to see children in programs, to talk with parents, to talk with providers. And that's all super, it's been very important. In addition, we've thought about ways to connect the dots. So again, thinking about the larger workforce, the economy, and how childcare is the providers and educators are the workforce behind the workforce, and really making that be very clear to people, to our legislators on what this means. If you don't have this critical foundational, I'll be almost infrastructure, like critical, like roads and all of that in place, this isn't gonna work out very well, this being the larger workforce, the economy. So really stressing the importance of this critical foundational structure, childcare, and the importance of it and the return on investment has been what's really helped in Wisconsin.
In San Francisco, the fact that we have this funding right now is as a result of sort of grassroots advocacy and the political sort of advocacy of teachers and families that put this on the ballot, got this passed, worked with our board of supervisors to ensure that we got this additional funding to help support compensation and subsidies for children that are on the wait list, income eligible children on the wait list. So, we're a very political city, nothing, a very, very active community of parent voices and family childcare educators and center teachers. They made this happen. And so we're very lucky that we have a very supportive board of supervisors here. And, we have this new Department of Early Childhood that the mayor created. So there's definitely political support in San Francisco that we rely on really strongly to help us move forward with the things that we want to do and to receive the funding that we do. So we're very lucky in our city. I recognize that.
So in addition to what's already been said, I think we all, I ditto everything that's been said. I'm an organizer at heart. And so I really do believe that the process of organizing in community and building a community infrastructure of advocacy is really important. Not a single issue, but across issues that affect children and families. And so I think the work that we've done in terms of building that coalition, having organizers on the ground, organizers placed at child development centers, not adding another layer of work to those administrators, but actually providing the folks that could help organize parents and providers. Part of that was helping both educators as well as parents learn how to do testimony, how to provide testimony, having them be the ones who visit policymakers in their own jurisdictions, in the District of Columbia, those are wards, and making sure that we were matching up those parents and those educators with their ward council representative, and really having those relationships built. And again, we started with having the piece of legislation in 2018 and didn't lose momentum for that for a lot of reasons. And one of those is having this coalition that was well supported. I really believe advocacy should be paid for, advocacy should be supported financially, and that we can't add it as another burden on folks who are trying to deliver services. So if anything, I would say philanthropy really can play and plays a tremendous role in supporting that aspect of it as we go after public dollars. So I think that I would add that to what's already been said.
This is all great and gives us almost actionable steps moving away from this and going forward on what we all can do that are here joining us. With that, I cannot believe that I'm already at this point where I have to say we are out of time. This hour conversation flew by. It felt like 5 minutes, and I glanced at the clock, luckily, to know that we were out of time. I want to thank all of you for joining, our wonderful panelists, for such a deep and rich conversation, and then for everyone who joined us as a participant to listen in and to engage in this conversation. We know it is one of the most critical and important that we have currently in our field of early childhood, and excited that we could host an hour with Bank Street to have this conversation. We will follow this by posting the recording of the webinar via our website and YouTube, as well as like a little blog on some of these key connections and resources that were shared so that we all can further this conversation. This is the second of a 3-part series. Coming up in this special series, the next one will be on August 9th. Strengthening Systems, Embedding Equity when Defining Quality. And you can register on our website. We hope to see you all there. And with that, one more big thank you, and we hope everyone has a great day. Thanks so much.